I am so excited to speak with you today about dental fear and anxiety. I hope you find it helpful. I'm a dental hygienist and I have a master's degree in public health, and I serve as the oral health director for the Vermont Department of Health. So understanding the progression of oral disease and how oral health is connected to overall health can be helpful in creating new health habits and facing fear. So I'm going to start off by talking about both of these things. And then I'm going to tell you about new ways of treating dental decay that don't require needles or drilling. I'm going to provide you with some information from the dental practice that I go to about how they help their patients deal with dental fear, and leave you with some strategies that you can use to create new oral health habits. And I just wanted to mention that my colleague, Deborah Teixeira, is here with me as well today, and she's going to be monitoring the chat. So I'm going to take questions at the end, but if you want to put them in the chat as you think of them, please feel free to do that. So before we dive in, I want to assure you that you are not alone. According to the 2025 State of America's Oral Health and Wellness Report, more than 1 in 5 Americans have avoided dental care due to fear. And for the purposes of today's presentation, I'm going to talk generally about dental fear, but there are different levels, including anxiety, fear, and phobia. Most people have some degree of dental anxiety, especially for more involved procedures. For example, I recently had a tooth removed and a bridge placed, so it was almost a 3-hour appointment. And I was definitely anxious about it, but I didn't let it keep me from making my appointment. So dental fear is more specific and often arises from a past traumatic experience. If you know what you're scared of, for instance, gagging, suction, drills, or needles, this is considered dental fear. It's also common to have more than one dental fear, and these fears can keep patients from visiting the dentist. Dental phobia is the most intense fear level. People with dental phobia might avoid the dentist indefinitely. Some people with dental phobia might still visit the dentist, but do so with extreme dread. As we know, dental hygienists are famous for telling you to brush and floss, and this is why. When we're talking about oral disease, we're talking about two main preventable diseases: tooth decay, which is also called dental caries or cavities, and gum disease, which includes gingivitis and periodontal disease. So you need 3 things in order to have tooth decay. You need the tooth, the bacterial plaque, which is that white sticky stuff that builds up on your teeth throughout the day, and carbohydrates, which break down into sugar. So when you eat food that contains sugar, the bacteria that live in the plaque in your teeth are fed, and they essentially poop out acid, which eats through the enamel. So it's not the sugar itself, it's the metabolism of the sugar by the bacterial plaque, the bacteria that live in that plaque. So this doesn't hurt until the decay is pretty far along. You can see at the picture on the left, there's a progression. So it's important to know that just because you don't have any dental pain doesn't mean that you don't have any dental decay. The good news is that you may have the chance to treat dental decay before it requires more complicated treatment. Gum disease is very common. It's characterized by bleeding gums and can progress to periodontal disease. Again, you can see by the picture that there's a progression. Periodontal disease literally means around the tooth disease. It affects the tissues and the bone that support and surround your teeth. So when you go to the dentist and they go around each tooth with that little picky thing, what they're doing is they're measuring the height of the pockets around those teeth, and that's an indication of how healthy the bone is. This disease is caused by plaque that hardens onto the teeth, and when this happens, the plaque is called calculus or tartar. Again, this may not cause pain at first, but eventually it can lead to pain, bad breath, and tooth loss. The main risk factors for periodontal disease are poor oral hygiene, so not brushing and flossing, and tobacco use. So as you can see, removing plaque from the equation is the key to preventing dental disease, which is why hygienists talk about it so much. Other ways that you can protect your teeth include being mindful of what and when you eat and drink. When you eat food, the pH balance in your mouth is lowered, creating an acidic environment. The bacteria in plaque that we talked about thrive in an acidic environment. The more often you snack and drink, the more often you're creating an acidic danger zone for dental decay. And I really like this picture on the left. It shows, when you're eating and how often you're dipping down into that danger zone, which is okay. You just don't want to stay down in that danger zone for too long. So the good news is that saliva and water buffer the pH balance and add a protective factor. Eating healthy food at designated times versus grazing throughout the day and drinking water are great ways to protect your teeth. Other things that you can do include brushing with fluoridated toothpaste and drinking fluoridated water. Fluoride is a mineral that hardens teeth. So when you drink fluoridated water, the fluoride is incorporated into your saliva and bathes your teeth throughout the day. If you're one of the many people like me who has reduced salivary levels or dry mouth because of a medication that you're taking, rinsing with water after you eat can be really helpful. Just rinse and swallow the water. Nobody has to know you're doing it. Even if your water doesn't have fluoride in it, drinking water is one of the best ways to protect your teeth. It neutralizes acids and washes away food particles and bacteria, helping to restore a more neutral pH and getting you out of the danger zone. So I want to take a minute here to talk about fluoridated water because it's been in the news a lot these days. The health department supports community water fluoridation at 0.7 parts per million as a safe and effective strategy to reduce dental decay. That being said, only about 57% of Vermonters who get their water from a public water system have fluoridated water, and many Vermonters get their water from a well. All water has some fluoride in it, but usually not enough to benefit teeth. I've included a link to the health department's statement on community water fluoridation, as well as links to more information, including a link to Vermont's Guide to Fluoride Levels in Public Water Systems, which contains fluoride levels for all public systems, whether they're fluoridated or not. And I've included a link to the health department's drinking water program for information about how to get your well water tested for fluoride and other things, as well as translated information about how the drought is affecting drinking water sources. So when we talk about how oral disease affects the rest of the body, inflammation is really important. As we talked about, gum disease can cause deep spaces or pockets around the teeth. In these spaces, certain bacteria that don't need air can grow and thrive. These are called anaerobic bacteria. These bacteria that don't need air are particularly toxic for the gums and the surrounding bones. Inflammation, the body's reaction to this chronic underlying infection, might explain how oral diseases are linked to other health conditions in the body. So it's not just the bacteria in the mouth that's the problem. It's how the body reacts to the long-term infection from these bacteria that's being looked to as the connection between oral disease and chronic disease. So here are some conditions that are linked to poor oral health. Periodontal disease in particular is associated with diabetes, heart disease, and stroke. In pregnant people, gum disease is also associated with premature birth and low birth weight. It's important to remember that the research thus far establishes association, not causation, between oral disease and other chronic diseases. So we can say that oral disease is associated with these conditions, but we can't say that it causes them. Now for some really good news. We can treat dental decay without needles or drilling, which has many benefits, including reducing dental fear. This type of care is referred to as minimally invasive dental care because we're treating dental decay with medicine that addresses the underlying infection without removing any of the tooth structure. Two of the main techniques used in minimally invasive care are silver diamine fluoride, also known as SDF, and silver modified atraumatic restorative treatment, or SMART, both of which you see here. SDF is a liquid that's painted on the area of decay to stop the decay from progressing. Again, it's painted on the area of decay, so not the whole tooth. The silver kills the bacteria and the fluoride strengthens the tooth. The downside is that the silver turns the area of decay black. That's how we know it's working to kill the bacteria. The tooth on the left has been treated with SDF. The tooth on the right is the same tooth that's been treated with SDF with the additional step of SMART. So a tooth-colored filling material covers the dark area and fills the cavity. Again, no needles or drilling involved. Minimally invasive care is much less expensive and takes much less time than traditional treatment. It can be done by a dental hygienist or a dental assistant, freeing up the dentist's time for more complicated procedures. For these reasons, minimally invasive care can increase dental access to dental care in dental practices because they can see more people. Minimally invasive care is also a game changer in public health settings outside of dental practices. At the Health Department's Office of Oral Health, where I work with Deborah, we support the use of minimally invasive care in our 802 Smiles network of school dental health programs. And minimally invasive care was provided at free pop-up dental clinics that were hosted by district health department offices throughout the state. It's important to note that minimally invasive care will not be appropriate for all situations. For example, if the decay is too far advanced or if the issue is structural, but it can be a great option for people of all ages. I've experienced minimally invasive care myself. I had a small area of decay between my two upper molars. My dentist suggested a filling, but I requested SDF and she readily agreed. SDF was applied using dental floss by my hygienist when I was in for a cleaning, and it was applied again when I came back for my next visit. My last x-rays showed that the decay had been stopped, and I avoided the drilling and filling. I want to take a moment here to show you a trailer for a documentary about dental practices that have fully adopted the use of minimally invasive care. One of the dentists featured in this trailer, Dr. Johnny Norris, is from Vermont. And this will take 2 minutes, but I really think it's worth it. Please give me a thumbs up if you're hearing it. Yeah. In preparation for this presentation, I asked my dentist how she helps patients deal with dental fear. There's a question about dental fear right on their health history form, and patients are encouraged to talk with their dental healthcare providers so that they can help support them through the appointment. Sometimes dental fear, as we talked about, can be so strong that people are really tempted to cancel their appointment, but that's not a good option. Keep that appointment, but let your dental healthcare provider know how you're feeling and be honest with them about your health habits. They won't judge you. This slide includes some things that my office offers patients. I was just in, as I mentioned, for a 3-hour appointment, and I took advantage of the heated blanket and the fidget ring, which I found incredibly helpful. As a matter of fact, I fidgeted it so much that I broke it, but that's fine. They had a bunch of them. They also offer weighted blankets, warm neck wraps, and salt on the tongue for gagging. They check in often and take things slow. And they can recommend, or they can prescribe rather, anti-anxiety medication if needed. In that case, someone else does need to accompany you to the appointment to drive. So I needed a tooth removed and a bridge placed, something that could not be addressed with minimally invasive care. But during the appointment, they found a small area of decay on one of the anchor teeth for the bridge, which could be treated with SDF. So this helped me retain as much of the tooth structure as possible and avoid any unnecessary unnecessary drilling. So here are some dental hygiene tips that I recommend that can help you avoid dental problems. I think the best feature of an electric toothbrush is also the simplest. It's the timer. It's recommended that we brush for about 3 minutes, but many of us only brush for about 30 seconds. Also, I keep floss right by my TV watching chair, and that visual cue is a great reminder. I also employ something called the gross yourself out method. After you floss, smell the plaque, smell that floss, and imagine that plaque staying in between your teeth. Gross, right? It's pretty motivating. When you're trying to start a new habit, tracking your progress on a calendar can also be motivating. When I was trying to make daily exercise a habit, I gave myself a star for each day I exercised, and I set a goal of 5 stars a week. Now, I don't know why this was so motivating, but it really helped me, and it may help you work flossing into your routine. Lastly, and this may sound a little silly, but again, it works for me, treat yourself with loving kindness and take care of yourself like you would take care of a pet or a child that you love. Make and keep those healthcare appointments just like you would for your beloved pet or child, and reward yourself for doing things that might seem scary or uncomfortable in the moment. Whether it's your dental appointment, your mammogram, your flu shot, an appointment with your therapist, or a colonoscopy, taking care of yourself is really something to be proud of. I have a friend who would think of her colonoscopy as a cleanse at a spa. So that is one way to frame it. So here are some nutrition habits that can reduce your risk for dental decay. Sugary drinks and carbonated beverages, even seltzer water with no added sugar, can reduce the pH balance in your mouth. And to be honest with you, that's how I got my area of decay. I was kind of addicted to seltzer water. And that's okay. But you can help reduce that risk by using a straw. By using a straw, you can minimize the effects of drinks on your teeth, but try to use a reusable straw if you can, which is better for the environment. As we talked about, sticking to designated meal and snack times rather than gazing all day can be really helpful. I try to stick to 3 meals and 1 snack a day, and 1 ice cream cone if I'm honest. Choosing healthy food like crunchy fruits and vegetables can help cleanse teeth and stimulate saliva production. Alternatively, sweet sticky food or highly processed food are not great options for teeth. So in closing, please know that you are not alone. Dental fear is incredibly common, but it doesn't need to get in the way of your dental health. The good news is that we have ways of treating dental decay that do not require needles or drilling, which may be right for you. If you're not already connected with a dental practice, talk to your friends and family about where they go. Dental healthcare providers are trained to help you work through fear, but they need to know how you're feeling in order to be able to help you. And lastly, treat yourself with the loving kindness that you would show to a beloved pet or child, and be proud of yourself for making and keeping your healthcare appointments. It's a really big deal, and it should be recognized as an accomplishment. You've got this, friends. All right, thank you, everyone. Now, looks like we have some time for questions, so let's see. Stop the recording. Let's see. Okay, Deborah.